Hello, Dr. Reema here from Reema's Routine. Today I'm here to discuss with you the vaginal yeast infection and its dietary management. The vaginal yeast infection is the infection of vagina and the tissues at the opening of the vagina. It is caused by the Candida albicans. It is treatable by a medical professional and usually self-diagnosed. And mostly it is short term and resolves within days to weeks, but at times it becomes chronic and bothering. It is a very annoying and rarely dangerous infection. However, symptoms include itching in the vaginal and vulva area. There is burning sensation in the genital area while urinating and intercourse. Cottage cheese like odorless vaginal discharge is there, and watery vaginal discharge may also be there. It is not possible for all the women to prevent yeast infections, but however, we can reduce the chances of recurrent or chronic infections. Firstly, practice good hygiene. Keep your vagina clean and dry. Wear loose and right kind of clothes, preferably cotton clothes, as they are breathable and they do not hold the heat or moisture and keeps you dry. Tight panties, tights or snugly fitting dresses can boost your body temperature and also increase the amount of moisture around the private parts. This can increase the chances of yeast infections. Don't douche. Use of feminine hygiene products like douches can disrupt the balance of bacterial flora in the vagina and raises the chances of infection in the vagina. Avoid bubble baths, soap sprays, deos, tampons as far as possible. Maintain proper diet, sleep and exercise. Avoid certain medications if possible. Risk factors that predispose to recurrent or chronic infections include all those things that alter your normal hormonal balance, including pregnancy, use of birth control pills and estrogen therapy. Frequent use of antibiotics destroy the useful bacteria that keeps the Candida population under control. Uncontrolled diabetes causes spike in the sugar in the membrane of vagina, and as we know, sugar encourages the growth of yeast. So chances of recurrence is common in diabetic patients. All those conditions that affect our immune system, such as HIV, are likely to cause chronic or recurrent infection. Other causes of recurrent or chronic infection includes obesity. It provides more area of moisture and warmth, such as skin folds in which Candida can grow. Clothing that is tight fitting, synthetic, keeps the vagina moist and warm and favors the growth of the Candida. Also, having an anatomy with short distance between vagina and anus can also increase or result in recurrent infections. To prevent the recurrent infection, one must maintain a healthy immune system. And how to have a healthy immune system? We must have a good rest and sleep. And to have a good sleep, you must avoid meals, exercise and caffeine 3 hours before sleep. A minimum sleep of 7 to 8 hours is must for a good immune system. Exercise, meditation and yoga reduces the stress level. Antibiotics should be avoided as far as possible, and we must keep control of the diabetes if it is there. Diet plays a major role in recurrent infection. How? As we know that sugar promotes the growth of yeast, we must avoid consumption of sugar as far as possible. Elimination diet or eliminating certain foods help in reducing the risk of yeast overgrowth. Try eliminating dyes. All the foods which are containing simple sugars, especially the ripe fruits which have high glycemic index, should be avoided, as sugar favors the growth of candida or yeast. White flour and gluten-rich foods should be avoided, like barley, rye, wheat, oats. Oats, though gluten-free, is avoided as it is processed in the same mill where wheat flour is milled. Anything fermented with yeast should be avoided, such as alcoholic drinks. Dairy milk should be avoided during the treatment period as it favors the growth of candida. Now, what is the recommended diet for candida? We have to stick to green vegetables, proteins, nuts, and herbal teas. Consume probiotics or yogurt containing live cultures of popularly friendly bacteria Lactobacillus acidophilus. Probiotics can help to restore the body's normal bacterial balance. It prevents the candida yeast from growing out of control and causing an infection. Home remedies for yeast infection are: first, natural therapy, which includes consumption of yogurt and probiotics, garlic, use of boric acid, application of oil of oregano, coconut oil, tea tree oil, and douching, especially with vinegar. The plain yogurt without sweetener and with probiotic live cultures may help to prevent the future yeast infections. It restores your gut flora back to healthy balance, killing the bad bacteria and increasing the good bacteria. This leads to the reduction in the infection. However, it is still to be proven that the consumption of yogurt can cure or prevent the yeast infection. Candida is naturally present in our system as it aids in nutrient absorption and digestion. But whenever it is overproduced, it poses threat to health. It can go in for or lead to yeast infection or fungal infections. So, whenever it is in excess, we must try to get rid of it by flushing it out through the digestive tract. Our main aim is to go in for yeast-free candida diet to eliminate its symptoms. Step 1 is cleansing. The patient is only on liquid diet. The aim is to cleanse the candida or clear the candida. The vegetable broth is made from organic onions, garlic, spinach, kale, sea salt, and pure water. It is allowed to simmer and finally strained. The vegetables are discarded and the broth, which is warm, is taken sip by sip throughout the day. And the aim is to take lots of water and expel the toxins which are present in our system. It is to be continued for a day or two and can be repeated as and when needed. Step 2 involves the consumption of steamed vegetables for a period of 3 to 5 days. Elimination of all grains, sugars, fruits, starches, and alcohol from your diet as they favor the candida. Now, what we can eat while we are on candida diet: we must consume fresh steamed organic vegetables. We have to keep away from starchy vegetables like carrots, radish, beets, sweet potato, white potato, as they contribute to excess sugar level in the blood and result in increase of the candida. Drink plenty of water, say no less than 2 to 3 liters per day, to flush out the candida. During this time, you can eat salads made from leafy greens or bitter greens, and it should be topped with a bit of coconut oil or apple cider vinegar or lemon juice. From the diet of candida, we gather that the top offenders include sugars, white flours, yeast, and alcohol. So, what we are supposed to avoid? All the fruits, starchy vegetable, and moldy nuts. The next step is inclusion of the apple cider vinegar, green veggies, green drinks, coconut oil, manuka honey, garlic, ground chia seeds and flax seeds, unsweetened cranberry juice, cultured dairy, and spices. They are candida killers. We can follow it for few weeks to several months, and it depends upon the severity of your candida, the intake and effectiveness of probiotics and antifungals, and how strictly we follow the diet. The final or the ultimate step is reintroducing the foods. Once you are free of the candida symptoms, start reintroducing certain foods. You must start with foods which are low in glycemic index, like green apples, and which are less sweet and little raw. Avoid overripe fruits. Now, how the candida diet helps. Apple cider vinegar helps to kill and get rid of the excess yeast in the body. Green vegetables and green drinks, they alkalize the body, which fights against the acidic nature of the yeast overgrowth. Greens contain no sugars or very little sugar and high amount of magnesium, which naturally detox the body. The vitamin C helps to build the immune system. The chlorophyll cleanses the body. B vitamins energizes the body, and iron and gives the body full support. Coconut oil has antimicrobial properties. Being a combination of lauric acid and caprylic acid, it kills off the harmful candida through ingestion as well as topical application. Stevia is a perfect choice for those on candida diet because of its antifungal, anti-inflammatory and antibiotic properties. It helps balancing the pancreas, which is often compromised whenever a individual has candida. Garlic is extremely potent and broad spectrum antifungal and is effective against candida. Role of ground flax seeds and chia seeds. The polyphenols found in flax seeds and chia seeds support the growth of probiotics in the gut and thus helps to eliminate the yeast and candida in the body. Unsweetened cranberry juice or the sugar-free juice corrects the pH level of the urine, thereby prevents the growth of the fungus. And the kefir, that is goat milk, displays the antibacterial and anti-candida effects. The active component of turmeric, curcumin, inhibits the growth of Candida albicans. Cinnamon helps to treat oral thrush, which is caused by Candida albicans only, and those who are supplemented with cinnamon generally suffer less with the Candida growth. Cooked vegetables, especially non-starchy ones like broccoli, cauliflower, asparagus, they provide valuable nutrients which help to fight the Candida. Researchers suggest that foods high in healthy fats and proteins protect against Candida. It is important to consume only organic, free-range meat. Bone broth is one of the best food sources to destroy the Candida due to its positive effect on the gut health. Pau d'arco tea is probably the number one thing to be added to your Candida diet, as it helps the body to fight the Candida the natural way. It's proven to have antifungal compound like lapachol, which has been shown to combat the Candida. Thank you for watching. Follow my channel and find me on Facebook and Insta for many more such tips.